Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCQ of the patient that you had requested. The area of interest is the lower mandible for the lower jaw for implant placement. Starting with the lower left implant, this is the implant which has the best bone support around it. So we wouldn't want this implant to be changed or removed. In the region of the lower left six, we've got an approximate ridge width of 12 millimeters and a height of approximately 11 millimeters. So an implant placement here is possible. Just distal to the mental foramen, we again have slight bit of bone, 7 millimeters of ridge width with approximately 12 millimeters of height. Anterior to the mental foramen, we have an implant which is placed very buccally, so no buccal plate can be seen. This implant definitely will need evaluation. If this is removed, the doctor will have very limited bone and this region is 2.9 millimeters, so this will need to be grafted for future implant placement. Just in the canine region, again, we've got very thin ridge. If this thin ridge is removed um, by 4 millimeters, then we've got a ridge width of approximately 6, and an implant can be placed here comfortably. The lower anterior segment definitely does not support any bone. We've got very thin ridge at the crest. This is the lower right. The implant is also suffering from severe periimplantitis. You can see it right here. This either is graft or soft tissue, but definitely there is periimplant bone loss of approximately 4 millimeters. This is the distal to that implant, the premolar region, T2 quality bone, excellent 8 millimeters of ridge width with approximately 10 millimeters of height. And then finally moving to distal of the lower right Ventral foramen is a sixth region. You've got D2 quality bone, 9 millimeters of ridge width with approximately 9 millimeters of height. And finally, the implant on the distal right side, again, very severe bone loss here. Approximate bone loss is about 4.5 millimeters on the lingual and 2.5 millimeters on the buccal aspect. If this implant is extracted, 14 millimeters of ridge width with approximately 10 millimeters of height.